with you through the burnout question. The young oncologists in ESMO have done a survey showing some of the figures about how treating physicians in a very interesting profession are living with the difficulties of cancer care. Thanks and welcome.
Thank you so much. So on behalf of the ESMO Young Oncologists Committee, I'm delighted to share with you the results of our survey of professional burnout in European young oncologists. Burnout is recognised as a growing issue across many professions. Our aim was to investigate the rate of burnout, work and lifestyle factors amongst young oncologists in Europe aged 40 or less. So what is burnout? Well, burnout is characterised by three main features. The first one is emotional exhaustion. Secondly, depersonalisation. And what I mean by that is having an impersonal approach, treating people like objects. And thirdly, personal accomplishment, having a low personal accomplishment. So, for example, the loss of meaning or purpose of work. So in this study, we measured burnout using a tool called the Maslach Burnout Inventory. Now, this utilises a 22-item questionnaire assessing these three areas. This is a widely used tool, and it is considered the gold standard to measure burnout. So here are the key findings of our study. 595 oncologists across Europe participated in this study. This is across 40 European countries. What we found was that the overall burnout rate was 71%. The burnout rates were significantly different across Europe, with the highest levels, as you can see from this slide, being in Central Europe and the lowest levels in Northern Europe and the British Isles. 74% of young oncologists reported no access to support services in their hospitals. And 63% felt that they did not have a good work-life balance. So next, we looked at the significant independent factors that we found to be associated with burnout. What we found was that the European region, having a good work-life balance and enough vacation time were the most significant independent factors. So let me illustrate this with an example. If a young oncologist felt that they did not have a good work-life balance, then they were over 3.5 times more likely to suffer from burnout. Finally, we explored whether it was possible to develop a model in order to predict burnout. And what we found was that the best predicted burnout model in young oncologists in this European survey included the above factors outlined, but also the travel time to work. And using this predictive model, we were able to correctly classify 75% of the young oncologists as having burnout. So to conclude, this is the largest and first burnout survey of young oncologists across Europe. We have shown that burnout is common amongst young oncologists and rates vary across Europe. European region, work-life balance, and vacation time were independent factors. Raising burnout awareness, support for oncologists, and further research are needed. Our survey are the first steps to achieving this across Europe. The full presentation, I'll be presenting on Sunday in the session between 11 and 12:30. Thank you for your attention.
Thanks a lot, Susie. As you can see, we are convinced that medical oncology is a rewarding and fascinating specialty. However, we now have to face the situation, and probably medical oncologists will need also some support in order to be able to deliver optimal care, and we are convinced this will impact the quality of care, but also the quality of life of our patients. So please come to listen to the full presentation on Sunday in this interesting session called Issues Facing Oncologists Today.